Well, in today's Eye on Health, a revolutionary new medical treatment is giving patients battling breast cancer both some comfort and also some control.
It's a new type of radiation, and it can be found right here in Western PA and in Eastern Ohio. Mikey visited with a patient and her doctor to learn how a device called the GammaPod made a cancer diagnosis a little less scary.
Went for my annual mammogram and came up with a biopsy then, and after the biopsy we realized that I was diagnosed with early stage breast cancer. It was a scary moment. Luckily my son came in minutes afterwards and kind of calmed me down.
Patty Manarino knew she had a family history of heart disease and wanted to minimize side effects during her treatments. GammaPod is an innovative form of radiation treatment for early-stage breast cancer that AHN Cancer Institute has brought to our region.
With GammaPod, try to treat as small an area of the breast as possible. When you do that, you minimize side effects. You can also shorten the course of therapy significantly from what used to be 5 or 6 weeks of therapy now down to 5 treatments over a week's time. Patty's case was she had an early stage breast cancer that was removed completely, and she was highly motivated to be the first patient with GammaPod because she wanted to minimize side effects, and specifically any risk to her heart and her lungs.
The factor of less treatments and the decreased risk of long-term problems to the heart and other organs, and I knew that that was the route that I needed to take.
She says each session was about an hour, including a CT scan and then the GammaPod, where you lay on your stomach and are stabilized for the treatment.
That lasts probably about 15 minutes, and they turn music on for you, so it's maybe 3 to 5 songs.
It's for small tumors of the breast and the correct patients, so it would be patients that have early stage breast cancers that have a target or where the tumor used to be that's able to be reached by GammaPod. In the Pittsburgh area, and actually nationwide, the incidence of breast cancer is about 1 in 8 ladies, which is significant, and that has risen from in the last 10 years. We're finding it more often because I think screening is really helping to identify earlier and earlier.
He also says death rates have dropped too, in part because of early detection and new treatment options.
But it's not a death sentence. Many more patients survive this than used to, and many more survive than die. And I think if you look at the overall outlook for breast cancer particularly, it's very hopeful.
The ladies must get their annual mammograms. Your body can change in a year. I am feeling wonderful. I'm babysitting the little one, getting back to work, waiting for summertime.
I'm Mikey Hood for PTO.
What a wonderful way to end, where
Yeah.
she's laughing and smiling. And you think about all the women who are affected by this.
Yeah.
This could really be a game changer.
So glad to hear that she's doing so much better.
And remember to keep watching for our Eye on Health series right here on PTL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.